This is skill 3 for CPR first aid rescuer 1. So remember, for CPR first aid, you're both going in 2 different directions. It's a 2-person event. One of you is going to begin with a patient who is unresponsive, no pulse, not breathing, and they're going to need CPR attention. Rescuer 1 is going to come then to a patient who first needs CPR. After you finish with this patient, you're going to move on to doing 2-person CPR with your partner on that other patient. And so in this scenario, it's an open fracture that we're splinting. I suggest watching that full splinting video that I've created for Cert Skills EMT and CPR First Aid, where I go through how to use one. This one's more going to walk you through what that rubric looks like. So as you both approach the scene and you're given your scenario, you and your partner are both going to make sure that on your rubrics that you're verifying that your scene is safe and that you're putting on your personal protective equipment, or PPE. You're going to come to your patient and check for responsiveness. Hey, are you okay? Can you hear me? And they're going to be conscious, this patient. It might be a mannequin. It might be a live student volunteer. Again, some of that's going to be COVID dependent. We do have access this year to being able to use that college space. We're going to moving towards not doing these in hotel rooms anymore and moving towards using lab space for the health sciences at our campuses, our 2-year college campuses. This year in particular, it happens to maybe be at City College, but it could be kind of anywhere like that if you're watching this video in future years, and I'm not remaking them, so I need to make sure I quit limiting myself. But I'm going to introduce myself to them. I'm Katie, I'm an EMT, or I'm trained in first aid. Can I help you and gain consent? As I do this, I'm going to look for where their injury might be as I assess my patient. Looking for any deformities, limited motion, pain, tenderness, swelling. If they were unresponsive, as well, I would look for medical alert jewelry or ask if they have any medical alert jewelry. So I want to make sure that I verbalize that. At this point, rescuer 2 is going to be calling to me for help with their CPR patient and ask me to call 911 and activate the emergency system to get an AED and that whole thing. So I'm going to respond to them, and I'm going to call EMS, or emergency medical services, for help. So I'm going to call and simulate with a simulated phone and bring that in there. I'm going to let them know the situation that I'm in. So I'm going to give them my scenario, the number of patients that I have, the condition of both patients, not just mine, but I'm speaking for also my rescuer 2. And then I'm going to verbalize I would only hang up when the dispatcher told me that it was okay to hang up. And after that, I'm going to take care of this open wound. So this is a little bit different than the ones that I've seen before. You're going to come in with a first aid kit. So we want to get a clean dressing of some kind and put that over that wound. So if it's an arm wound, we're going to take this dressing packaging off and cover that with a clean dressing first and bandage. So bandage and then dress it with more of a wrap type dressing. It could be something like this, and get that wrapped. From there, I am going to take a cold pack that we would provide to you onto that injury, and then I'm going to make a splint. So again, you might have splinting materials in the room. You might have your own splints in your first aid kit, and then just follow those directions that I've given to you in that other video for placing a splint. We want to put it below and above that injury. This scenario doesn't talk a lot about in their rubric about checking pulse, motor, sensory, but always a good habit to get into from that other video that I talked about. We want to avoid bending or straightening that bone any more than possible, especially because of the open wound nature of this. And I want to encourage my patient to keep still on that limb and make sure that if I'm using a hard splint like this one, it has a hard side and a soft side that's padded, that I obviously put that padded side towards the patient as I do that. So again, I'm not going to waste your time showing you applying these splints. You can see that in that longer splinting video. And then the last thing you want to do is make sure that you change gloves between patients, because you are going to now, you've finished this patient, you've got their splint secured, you feel good, it's on ice, it's closed, it's clean. You're going to go help with that CPR patient. So verbalize that you would change gloves, and now you're going to go to that CPR scenario.